Unshelling Medicine Podcast. Healthcare in the language we understand.
Hello, good afternoon, good morning, good evening, good day, everybody. Today, I have the pleasure of having Lidia Molinara with me. Lidia is a pharmacist. Yay! So today we're going to talk about something that most people struggle with quietly and sometimes out loud: medication management, medication reconciliation for both providers and patients, and also polypharmacy. We see polypharmacy a lot with the elderly, geriatric population, and people with chronic disorder of different age groups. So how best to navigate this difficult area in our lives than to actually have a pharmacist who understands medication and, what to do, what not to do, who to talk to, in order not to accidentally cause a fatal or near fatal reaction. So thank you, Lydia. Welcome.
Thanks for having me. Great to be on the platform. I appreciate it.
Thank you. So, where do we start? Pharmacy. So, what would you say? I would say, first of all, would like to know how you got into the field of pharmacology and what actually interests you in disseminating information that is helpful to the general population, the everyday medical patient, I would say, or medicine receiver.
Well, really, it's been my 30-year span of a career. I owned and operated pharmacies for a betterment of my career. And what I found was a lot of patients, and, I worked in long-term care, assisted living, worked with patients, nurses, doctors. We did rounds. I became a prescribing pharmacist as well. And what I found was we somewhat have this culture of safety sort of embedded in us. We don't necessarily talk about the risks of medications. Oftentimes when we go see a doctor, we expect to walk out with a prescription. And when we don't, we're sort of disappointed, like, did we actually get what we needed? When we came in the first place, why didn't I get an antibiotic? Shouldn't have I got one? I sometimes hear this. So my experiences being on the front counter basically have propelled me to understand that there are a lot of medication mishaps that occur. And the reason for it is because we don't necessarily ask the right questions, or we don't ask enough questions. And I think we really, as pharmacists too, the work environment doesn't allow us to enable a pharmacist and patient discussion where some of these things can be explored in detail. What are the side effects? What could happen long term? How long should I be on this medication? In the first place, why should I be on this medication? So it's really important to look at the angle of what should you be asking the doctor? What should you be asking the pharmacist? What do you do when something's not right? Because oftentimes we don't even think it's the medication that causes the problem. Mm-hmm. So this has kind of been the journey that I've gone through. And I've done, radio talk shows before where people have called in and said, well, the doctor tells me which medication to take, so I just simply take it. But really what we found is preventable errors go down when we as patients are more active in our healthcare. And so I'm really trying to encourage people to understand that important aspect of reducing errors happens when you become an active participant in your healthcare. And so oftentimes the question becomes, well, how do I do that? And ultimately, what I've basically seen in all of my years is it's the three principles of ACE, which is A for advocate, C for communicate, and E for educate. So that's basically what I'm trying to let people understand. And my journey has led me to know that if you incorporate being, number one, knowing your right, that you have every right to speak up and you have the ability and the responsibility, because it's your own body, to acknowledge and communicate that, you will have reduced errors. And there is significant errors when it comes to medications. And as you alluded, sometimes there are errors where, we talk about mishaps, but we talk about errors that are sort of caught. So near miss errors. So you go to the pharmacy, you pick something up, you notice it's not right. And the pharmacist says, oh yeah, the doctor changed the dose. And you're thinking, well, no, the dose shouldn't have been changed. So it's like a near miss. You didn't actually leave with that medication. But then there's times where you do leave with it and then it causes you to end up in hospital. Well, that's one error. And then the worst, of course, is if it causes you or a loved one to pass because of an error. And these things have happened. And we know that. And that propelled me to become a patient safety officer as well, to sort of look at how do we reduce these errors.
Right. So the average person, in my experience, because we have a reverence for the people who are in position of authority in medicine, in healthcare in general, right? They feel speaking up or saying something as a challenge or questioning to the doctors. For somebody who may say, best case scenario, noticing that the dose changed and asked a question about it, what would you say to people who feel like they don't have a voice in questioning their dosage, medication change, even if it's like just to a different brand of the same medication? What would you say to a population of people who may feel that way, because they do exist?
Yeah, well, absolutely. I mean, as pharmacists, oftentimes we act as advocates for our patients, and we have to speak to the physicians and say, client wasn't aware of an increase in dose. Is there a reason for this? Sometimes we'll get the answer, yes, it hasn't been working, so we've increased the dose. Sometimes we'll get, oh, no, I didn't mean to increase that. There must be a mistake. Doctors do drop down menus to write prescriptions, and sometimes they just pick the wrong strength. Other times it's, oh, I want the patient to try the new strength. It's it's going to go up for them. And now it's been 2 weeks, it should go up.
Right.
So we often take that information from patients and then we'll relay it to the physician and say, oh, okay, look, but the patient's really feeling stable on this. Do they need to come back and speak to you about it because they're not interested in taking that new dose? Sometimes it's a financial reason where the new dose potentially might not be covered. There's some ADHD medications where the 10 milligram capsule is covered, but the 20 milligram isn't. So then they have to take 2 10s, and it's just cumbersome. So we act as advocates that way. But the other thing is if the patient is sitting in the doctor's office, alluding to the question you asked, and they're feeling like, I don't want to increase this dose. My suggestion in that is, instead of feeling like you're challenging the physician, think of it as your physician is there for you. It's your body, and you need to have that open and honest discussion. So my question would be, I don't feel comfortable. I would say, I don't feel comfortable with this increase in dose. Is there a way that we can leave it at the same dose until the next visit to see how I'm doing? Or I can come in if I don't feel like it's working, because right now it is working. Or you can say, I might try it for a week, but then if it's not working, can I go back down on the dose? So when you go to the pharmacy, what I would do at that point is, if it's supposed to increase to 20 milligrams, I would get a 10 milligram, and then that way you could adjust it. And I would speak to the doctor about that. Can I take the 20 milligram tablet, but in 2 10s? Can you write the prescription that way? And then I can adjust it accordingly and see how I do. Now, some medications have what we call a narrow therapeutic window where that's not possible. It's one or the next step. Others, there's flexibility there. So it's really important for you to get into the mindset that it's your body. It's your responsibility to speak up for yourself. And if you have a physician who says, no, I told you to take 20 milligram, and that's the end of the conversation, then he's not a healthcare, that physician is not your healthcare provider. That physician is acting like what I would say an authority figure, and isn't listening and isn't, feeling, understanding what you're going through. You're not being seen and heard. And when you're not being seen and heard in healthcare, that's when it's time to find someone where you feel seen and heard. But the caveat to that is you need to speak up then. So if you stay quiet, nobody can read your thoughts. So you can't be seen or heard if you're not speaking, if you're not going to get the help. So you need to speak up and exactly explain why. And I would also say, I don't want to take that medication in increased dose because at this current dose, I already have diarrhea, or I already go to the bathroom 4 times in a week and it's too much, or I'm constipated and I don't go enough. If I add an increase in dose, won't that make that symptom worse? So that's how I would have the conversation. Explain why you want or don't want to go increased in dose, and then give backup to it. Explain your situation, because like I said, nobody is in your body. You need to explain that.
Beautiful. And that is the core of patient advocacy and just being a good human, right? I just had this conversation yesterday, which I said, if you feel as a patient, as a healthcare recipient, you cannot talk to your provider without feeling judged, without feeling like, you're subservient in any way, without feeling that your voice is not being heard. That is not your doctor. That is not your provider. Look elsewhere. And this is very common, and some of us are aware of it, some of us are oblivious to it, that patients hide information from their doctors, vital information at that, because they fear the judgment, they fear the chastisation. You shouldn't do that because herbal therapies are not fashionable. And we risk getting into the situation where we have interactions, right? So let's segue into herbal remedies, for instance. As a pharmacist, when you are filling a prescription for a patient, I know here in America, we have the box that pops up when you go to pick up a prescription, that asks, do you need further education on this medication, right? And it's just easier to hit no, sign, and get out of there, right?
Right.
You'll find that there's a need to maybe go a step further to provide additional education, especially with medications that have a high risk of interactions with other things, say herbal remedies or even grapefruit juice or grapefruit in general. Is there like a safeguard to, yes, you did check no, I don't want to force education on you. However, you should be aware of this, that, and the third.
I don't believe that no matter how long you've taken a medication, that speaking to a pharmacist and asking more questions is going to cause you harm. I think it's the opposite. So if you check no and walk out, you're missing that opportunity. First of all, you're paying for the prescription, and part of that fee is to speak to a pharmacist. So I, as a consumer, want to get every last ounce of value for anything that I pay. And so I would never click no. Even if it's going to take me an extra 10, 15 minutes to wait for that pharmacist, I would click yes, especially if it's a brand new medication. If it's a brand new medication and you've never taken it before, you're doing yourself a disservice by not having that extra piece of knowledge. Because let's be honest, how many times are you going to take that, sheet of paper that the pharmacy gives you explaining everything and read it thoroughly? And number one, understand it in the sense, because some of the terminology on there, it'll make you want to ask a question. What does this mean? And secondly, it's so much easier when you're speaking to a pharmacist and explaining your situation so that the medication is sort of like, yes, based on your situation, here's the reasons why you would want to take it this way. I really have a sensitive stomach. Then can you take it with food? Yeah, I would take it with food, because it might say do not take with food, but in fact, it probably is okay still. And then you don't take it with food, you get nauseated, or you feel like you're going to end up getting sick, and then you stop taking it. Well, now you've wasted your money and you've wasted all that time. So for those extra 10, 15 minutes, I would take that opportunity. The other thing is, you could also be on a medication for 20 years and say, yeah, I know how to use this medication. I don't need to speak to a pharmacist. Well, I had that exact situation where it was busy and I went up to the front to ring something in. Client came, picked up a medication. I grabbed it and I said, any questions? And she says, no. And I said, okay, no problem. Just make sure every time you use this inhaler, you shake it really well and you wait 30 seconds to a minute in between the puffs. And she looked at me and she said, nobody told me I had to shake this. It's been 25 years that I use this. And I said, well, that's probably then a really good thing to do. You have to shake it. Otherwise, when you hear the that comes out, you're not actually getting drug. You have to shake it. And she says, that's why I have to use so much of this. And, something just as simple as that, because nobody's taught her that. And again, she never spoke to a pharmacist ever since she picked it up from the first time. Right. So I've had many situations like that happen where speaking to a pharmacist, when I've had the patients talk to me and they say, I've come in to pick this up because I have a really bad yeast infection. But the prescription was for the actual antibiotic that they were on before, but they filled it in their pharmacy. And so I was like, but this is an antibiotic. And so she says, no, I already took that antibiotic. So, these miscommunications from prescriber to prescription to pharmacy, speaking to a pharmacist helps eliminate them. So it's almost essential. I mean, like I said, you're paying for that. I would definitely speak to a pharmacist without question and ask, how do I take the medication? Your point about grapefruit juice. There's foods, there's other drugs that can interact, over-the-counter medications, herbal products that interact. You should be asking. And as well, disease states. So if you have a thyroid condition, you shouldn't be taking your thyroid medication with iron, or you need to take this medication the first thing in the morning when you wake up without any other food. So there's different things that you eat, that you take, that shouldn't interact with it. And be honest, you know, I'm going out with my friends. I've had this question asked. I'm going out with my friends. It's my friend's bachelorette party. Can I drink on these antibiotics? Can I drink with this medication? And so, you know, alcohol interacts with medications, you know, marijuana, other drugs, they're drugs, they interact. So it's really important to be open and honest with those questions, and to have that, like you said, the space where you don't feel judged. That's really important as a provider to provide that to our patients, that psychological safe space. So if you're not speaking to the pharmacist who has the wealth of knowledge when it comes to medications, you're doing yourself a disservice.
Absolutely. So these are conversations that we need to have as a community, as, you know, advocates for people, as people who have experience in the industry and have seen many avoidable things. So please, if you're listening, whoever is listening, do not click no. It gets you out of the door quicker, but it also increases your risk of making a mistake higher than, you know, having a simple conversation. Hey, I'm doing this, and that, and the third when I'm taking this medication. Is that recommended? Is there anything else that I should know? Yes, no, and no. You're good to go, and you're out the door. Please utilize it. You're paying for that service. I know money speaks, money talks. If you're paying for a service, get it. It's like going to any fast food restaurant and getting half of your order when you paid for a full meal, right? Any restaurant did that. You know, it's like walking into a store to buy a dress and you split it in half and take the half home. You know, it doesn't make sense, right? I'm trying to, you know, make it make sense for a lot of people. It doesn't make sense. And those herbal remedies that we use, yes, those herbal remedies could work wonders for you. However, what are they doing for your current prescribed therapies if you're using them in tandem, right? How long is that herbal remedy staying in your system before it gets excreted, so you don't end up heightening the effect of your pharmaceutical or diminishing it? An example that I tell, especially with medication, as a nurse case manager, I did a home visit one time for a patient who let her doctor have it. The doctor was quack. He didn't know what he was doing. He was crazy. She's on all this medication. Nothing is working. And decided to pay her a visit. And part of the home visit was home environment safety, a comprehensive assessment, and a medication reconciliation, right? So I asked her for medication. She brought me a bucket of all the medication that were prescribed. And I was sitting there taking inventory of all the medication. She had a seat while I was taking inventory and having conversations with her, also educating her, you know, asking questions about each medication just to find the opportunity to provide the necessary education. Do you know what you take this for? How many times a day do you take this? What are the indications? What should you not do or do? And she was very knowledgeable about her stuff, and most patients are. And the one question that I asked her was, is there any other over-the-counter medication that you take? I would like to know. Or nobody ever asked me that. I'm like, yeah, I'll just like to take a look and see what you have. And she pointed me to a basket, and I got up, grabbed the basket myself, again, going through over-the-counter stuff, right, taking inventory. And I picked out a bottle, and I asked her, how often do you take this pill? Oh, you know, my neighbor down the hall recommended it, you know, and I've been taking it ever since, and it's so good because it's supposed to detoxify your body, cleanse you out, and then I'm like, oh, that's great. How often do you take it again? Oh, every day. I take it every morning with my medication. Guess what it was? Activated charcoal.
Oh, no.
Yeah.
So none of her medications would work, right?
None of the medication would work. What is activated charcoal? What is it used for? It's a detoxifier. So it detoxifies everything, right? Everything. So whatever she was putting in her body was just being sucked out by the activated charcoal. So be educated about what interacts with what. The people that are more comfortable with herbal remedies, and they're not often honest with their doctors or their pharmacists about utilizing herbal remedies or holistic therapies. Please do that, because you may be causing more harm than good to your body. And if you find that you have a provider that you cannot openly communicate with in that sense, please, 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 please try to find somebody else that would listen to you and not judge you, because that's a big thing. That's a big thing with honesty and a relationship. You have to be able to have some form of a relationship with your provider, a relationship of respect. Okay, the same token, if somebody's a caregiver for an elderly parent who's a dialysis patient, you know what you don't give too close to dialysis? You've done blood pressure medication. Why is that? These are questions, these are things that people don't know. These are things that we can educate people on, right? You talked about antibiotics and alcohol, right? These are things that people don't know. Even antibiotics and birth control, right?
So that's right. Oh, that that's a big one. Yeah, that's a lot of babies. Yep. That's definitely a big one. There's lots of drug interactions with medications and also with supplements. Mm-hmm. So if you think about, protein powders, sometimes they have iron. And if you're taking, medication for your thyroid, like Synthroid, you shouldn't mix calcium and iron with that. And so we see people who have been stabilized on their thyroid medication all of a sudden now not, and they have to increase the dose. And I know even one time when I was asking the patient, oh, this is an increased dose, anything else change? And she says, oh no, I've just really started to get more fit. And I started using this protein powder. And I thought, oh no, what time do you take the protein powder at? And she's like, oh, I take it every morning with my medication. I just drink it with my medication. And I was like, oh no, does it have iron in it? Does it have calcium in it? And she's, I don't know, I'll have to check. And she's like, I bought it here. Let me look. So we go and we look, and I'm like, yeah, no, you got to separate it by at least an hour, 2 hours best. And I said, that's probably what's causing this. So now here's a simple thing. Now she's having to increase her dose, which you don't want to ever have to increase the dose if it's just related to an interaction. That's where I look at it and say, now you're spending more money potentially on an increased dose versus not having to do that. And it's not about only the money, but at the end of the day, now you're buying a protein powder that's not really working, because if you're expecting that it's going to help, yeah, you're getting the protein, but the other ingredients in there is not working. I also had a situation where a patient had iron toxicity because they were taking so much of the protein powder. So you talk about every medication, whether it's a supplement, a herb, an over-the-counter, they're all chemicals. They all interact some way. And our food, in a lot of ways, they're chemicals in our body. Our body uses those, whether it's processed food, which then can cause harm to the organs, or other foods like an apple where there's fiber added, it interacts within our body. So we have to look at those as an entirety. And so having a list of medication, including your herbal medications and your supplements, maybe you just feel like, you know what, this is the only doctor that I can go see, but I don't really have that safe space. So don't have as much conversation, have more written communication. So just hand the list to the doctor. And if the doctor looks through it and says, oh, how are you taking this? Have it written down so that exactly how you're taking it truthfully is in there. So if it's prescribed twice a day, but you've only been taking it once a day, and that's been working and your lab results are okay, you don't want to increase it now to twice because you've got it stabilized. But if you're not stabilized and the doctor looks at it and says, oh, you're only taking this once a day, actually, that might be why your labs are not showing a result. We might have to increase that. Just be honest and then say, no, I don't want to increase that because this is what happens when I did take it twice a day or whatever that looks like. So I think it's really important to have a list of medications, even in an emergency situation. Have a list of your allergies. Don't just keep it in your phone. put it in your wallet, keep it in your car. These are life-threatening situations, potentially if you're in a car accident, if you have an allergy to a medication and you go into emergency and nobody knows about it. Now you have that emergent situation. Plus they're going to give you, let's say, an antibiotic, and you have an allergy to it. Now you've got a rash and you've got hives and you've got all this other potential stuff that can happen that you don't need to. That can be prevented by one simple thing. EMS will find that card. Your emergency services will look for that. But if you don't have that recorded anywhere, we can't find it, right? And then it's after the fact. So it's really important to have that. When you're at the pharmacy, the other thing that I always say is don't leave until you've opened the bag and you look inside the vial, whether that's a bottle or it's, the vial or a box. Make sure it's the right strength, because like I said, situations happen where the physician might write an order and it's a 20 milligram strength. You've always been on 10. You don't know that there's a change. Those conversations have happened where we have to then go back and say, oh, no, the patient thinks it's supposed to be 10. And so if you don't look at it before you go home, the minute you leave to go home, now you're coming all the way back. So when you click yes, you're speaking to the pharmacist. Oftentimes that's when you'll take it out of the bag and have a conversation about the medication. That helps with that as well, catching those mistakes. And there's been situations where patients have said, oh, this was white before. Now it's pink. Why? And automatically as a pharmacist, we go into detection mode, right? All of it goes off. We're like, oh goodness, okay, let's figure this out. So we'll go back, we look at the prescription, we look at the medication. Did we dispense this wrong? Was the prescription written wrong? Was there a change in the way that the tablet's made by the manufacturer? All those things is now something that needs to be resolved. And if you don't look at it, and then you got to come back, like I said, so all of that time, and maybe you're taking it wrong because you don't notice, then all of that is preventable. So just do it right then. And that's what I always suggest. And if it is wrong, or if they say, the brand changed, it's now, because shortages happen. This medication's now this, so it looks a little different. You know what I would do? You're there, you got your phone, or you ask the pharmacist, well, can I see that? Because, it's a different color. That makes me uncomfortable. That's the reasoning I would say is that makes me uncomfortable. Can I see that it is that? Do you mind? Because I have to take it, and it makes me uncomfortable to know it's different. And then the pharmacist, most pharmacists, 99.9% of pharmacists would be more than happy to show you, to reassure you. That's 2 seconds for them to grab the bottle and show you that that's what it is. Right. So I think it's really important to advocate in that way. I always say be assertive, not aggressive, because I have had patients swear at me and become very aggressive. And that's as well as a pharmacist, as a healthcare professional. When you switch sides, you understand the frustration, the person's not feeling well. They've just gone through 15 different doctors and specialists, and this is just an accumulation of it. And now they get to the pharmacy and the pills looks different. It's frustrating. Mm-hmm. So I understand that. I sympathize with that. I have empathy for patients going through that. But some pharmacists are more skilled at handling that. Other pharmacists would shut down, and then you're not going to get what you need. So I think the best thing to do is to be assertive in the sense of just saying how you feel in a way where you would want to have someone talk to you in that same way. I think that's really important, because sometimes we encourage advocacy, but if you, like any communication, if you become aggressive, communication is going to shut down. You're going to be asked to leave, and then your point is lost. And that's not what we're trying to advocate for. We're trying to advocate for you to get the knowledge you need so that you stay safe, not be shut down and asked to leave, because that doesn't help. So I think it's really important to have these really good conversations with your pharmacist, as well as explain what you're going through, because sometimes you're getting put on a medication and you're just not sure why, or, how is this going to work? Or when you hear it all, you're like, I don't feel comfortable with that. I don't want to take this. And so that's where a pharmacist can help you. They can speak to the physician for you and be your advocate, right? We act that way because sometimes we'll take it home and then we never use it. We don't want to. We didn't want to when we picked it up. Well, then just have that conversation right then and there, because it's going to help you resolve that.
Right.
And you have every right not to want to take it, right? Like it's your
True.
body. But you know,
Right.
it's like, I know that one of the diabetic patients I had was transitioned from pills to insulin and now had to do injections. And she said, I won't inject myself. I don't want to do this. I don't want to give myself injections. And just looked at the whole thing and was like, this is too complicated for me. I don't want to do this. So we sat down and we had to look at, okay, can we give you some longer acting insulin so that you don't have to inject after every meal? Or how can we make this happen so that you feel more comfortable? Is there a caregiver that can provide you with this to help you? And there's some pharmacies that offer services where they do the injections. So, these are the things that instead of just walking away and not asking, you can ask these questions and sometimes you can get the help you need for those hindrances. And if it's flat out, I don't want to take these medications, then that's okay too. You have a choice in that manner. You have to understand the consequences of it. You have to know the risk versus benefit of that, but it's still your choice. That is your right.
Absolutely. That's so true. In the concept of the medication changes because again, manufacturers change production or it may not be available from this manufacturer, but the other one, have it available and in stock. And the difference could be the shape, the size, the color. It is important that you do bring up something so that way if it was actually a medication error, it can be caught or if it was just a matter of manufacturer change in pill presentation or manufacturer change in general, you can be also educated about that. In a clinical setting with my student one time, there was a patient, I can't remember the medication that we were administering, and he made a comment like, this is different in the hospital. The one I have at home is shaped in, he described it. And it's like, for the last 15 years I've been on this medication, I have seen a variety of color and shapes. But one thing stands true. It smells awful. And that is his way of identifying the medication just by smell. It's like, it doesn't matter what form it comes up. If I smell it and it smells, horrid, that's exactly what I need to take. Coming to communication, we're all humans. We need to treat each other with respect, love, and compassion and empathy. The same way you would, I understand frustration and sometimes it burrows over. If somebody calls your attention to the way you're presenting, do a little bit of self-inventory and maybe the target in front of you is not your intended target. Maybe the doctor frustrated you before, that insurance frustrated you before, whatever coverage you had frustrated you. It is not the pharmacist who is trying to call your attention to something. I listened to Judge Lintola. So she's a TV circuit judge, and she was talking to a couple. And the one half of the couple, just was very sparky in a sense. And she asked her, "Why are you angry?" It's like, "I'm not angry. I'm not angry right now." So the point is like this exactly the presentation. And the advice she gave is that, you lose the validity of your concern when you strap your concern to a missile, right? So if that concern is strapped to a missile and it goes to the intended target, yes, it hits the target, but what happens to that concern? It's eviscerated. That's it. It's done. It's gone. However, if you take that same concern, fold it up, put it in a bottle, and float it right down the river or ocean, where it can be picked up gingerly, open, and read, right? It will have a different effect than, the missile, right? So frustrations do happen. We understand that. However, please also understand that the medical providers who are in your communities, who are in your different doctors' offices, are there to help you. The ones that are actually there and asking questions and making time to answer your questions. Are there rude people in the world? Absolutely. Those are not the ones we're talking about. We're talking about the actual people who are concerned and advocating for you. So the same empathy that we extend, it'd be nice for us to get it back. So I want to segue into medications that cancel things out, because recently, especially in the Western world, especially in America, women unexpectedly having advanced age pregnancy, I should say, because of weight loss medication. we're talking about the GLP-1s, right? For weight loss. So I know I mentioned briefly antibiotics and birth control. So, especially for women, is there something women should be aware of whenever they're starting any medication, especially when it comes to reproduction or reproductive health?
Mm-hmm. For sure. And I mean, also things like Accutane that can cause problems. There's also medications that if you're thinking of getting pregnant, that you should not be taking for months before you think about getting pregnant. And like Accutane is one of those, the tretinoins, the ones for acne. You have to be very careful with some of those medications. The Ozempics of the world in the sense that also with some PCOS diagnoses, we found that now people who have PCOS are getting pregnant while on it. And it was very difficult for them to get pregnant before because the blood sugars are coming down with it. There's mechanisms that are still not 100% known, but that's creating a problem in the sense of if you're not expecting to become pregnant, it's not that it's a problem if you are, because if you've been trying and now all of a sudden you are, that's fantastic. It's something that you'd want it. So that's an issue. Antibiotics and birth control pills. In general, birth control pills, you have to be very careful because they do affect our hormones. We don't have necessarily, I would say we do less in women's research than we do in anything else as far as research for women's health and advances for that, which is a whole thing. But when we look at these birth control pills that were developed in the 60s, not much has changed. We haven't advanced them very much. We've kept them the same. Hormonal therapy, when we talk about menopause and premenopause, what happens in that? Patients that have had hysterectomies, we don't have enough knowledge base. We've had studies that have happened a long time ago to suggest that if we use estrogen, that there's an increased risk for some patients in getting, cancers like breast cancer. But then for the other population, because it wasn't a huge study, we don't have enough knowledge to know if that in the general public would happen. And we don't have enough patients on these medications to know. So I think there's a lot of work that needs to be done with females and reproduction, as well as things like disease states. So really making sure and reinforcing HPV and how that can cause problems with cervical cancer, bleeding, heavy bleeding, sometimes just, it's a woman's issue.
Right.
We don't track our periods enough, which we need to do. And then if you have heavy bleeding, can it be medication related? Can something trigger your hormones so that now as a female, your bleeding cycle changes? Well, that can happen when we take birth control. If we're using an injection, a progesterone injection, that can make you not have a period. So is that okay? There's been times where we know and we read about it where women don't have periods and they think nothing of it and then end up in a merge delivering a baby because in fact they were pregnant the whole time, but it was because they weren't having a period that they didn't know. This is real. This actually does happen. So there's a lot that goes into the female reproductive system and medications for that. And something just like, you have your adenomyosis, your endometriosis, all of the uterine and cervical issues that a lot of us don't know about and we don't track and we don't do enough as women for making sure that we schedule ourselves for follow-ups and for regular screening, which is really important to our health. And if we're not aware of what we should do when, your physician knows this, your pharmacist knows this, your nurses in many different situations, nurse practitioners, they know that as well. The screenings are really important for women. And I think sometimes it's difficult because we're kind of told, it's probably hormonal. When it has nothing to do with our hormones. There's a condition. And I've seen, IBS sort of, it's probably hormonal. But in fact, no, it's endometriosis. And it's because the lining has, infiltrated and sort of is in the bowel. And now that's creating all of these issues. So we know this exists, and medications that are helped to treat this sometimes cause issues with our reproductive system. It's either helps it or can harm it. So if you're thinking of becoming pregnant or you don't want to become pregnant, you need to ask those questions. The other thing is if breastfeeding, when we breastfeed, I had a lady come in with her husband and the baby was 2 weeks old. And I mean, good for her for leaving the house. Because after 2 weeks of me having my baby, I don't think I left the house for 2 months. So, I
That's
mean, I was like, wow, good for you. Because I was like, wow, good for you. I mean, that's fantastic that you're up and walking and out of the house. Because I think I went into like, I'm just going to not move anywhere for 2 weeks out of this chair and just feed for every 2 hours and sleep in between and eat. That was basically, what the baby was doing, eat, sleep, and poop. That's what I was doing at the same time. So it's kind of one of those things where, right, she
some
comes
cultures
in
actually,
and
they enforce that confinement, though. Some cultures actually
yeah,
enforce you staying indoors, like you can't come out. It's only in the
yeah,
Western world we feel like, we have to go back to work. But I think it's nature's
yeah.
way of, we've just gone through this very, traumatic yet joyful thing. So, yeah, go ahead.
Yeah.
I want to hear about this
Oh,
lady.
it's so true. So she came in and she was breastfeeding and she had pain, right? She had some pain, and she now kind of was catching a cold, and she was asking about cough and cold medication, and she wanted to know if she could take some Benadryl. And I said, and some other medications. And I was like, okay, but I mean, she just presented. The baby was in the cart, right? I mean, I didn't see that the baby was 2 weeks old. I didn't, so I just said to her, oh, are you breastfeeding? Because I could see she had a baby. And she's like, yeah, the baby's 2 weeks old. And yes, I'm breastfeeding. And I've been taking this at home. And I said, no. And she says, yeah, is that why the baby's got diarrhea? And I was like, yes, you should not take that, because it can. And, oh, well, yeah, the baby's also sleeping a lot more. And I'm like, yeah, that's the other drug that's in there that's causing a problem. So we don't really think that breastfeeding and medications can go to the baby, but it does. So you also have to ask when you're taking a medication, if you're breastfeeding, pharmacists don't know. And this day and age with clothing and things, we don't know if you're pregnant either. So you need, we can't assume that you're pregnant. It's not something that we're going to come out and ask you, are you pregnant? Because we look at you. We don't do that. So, you have to also remember a pharmacy is crazy, like things are ringing off the hook. People are waiting. There's a doctor on line one. There's this that needs to be checked. There's that needs to be done. This needs to be signed. The guy's waiting for this. All of this is going on. We don't always focus on those little things. So you as an advocate need to say, I'm pregnant. I'm breastfeeding. I'm having issues with my periods. Can this affect that? It's really important as a woman to do these things. Really important, because tracking your period, it's a sign of health. Yeah. We have other organs like our uterus, our ovaries, our cervix that we need to consider and we need to worry about. Those are things that are definitely correlated to our periods and bleeding. So we need to know what's normal for us, and when it changes, why. And think about the medication. We don't think the medication can cause it. I always say, if you're taking a drug and you have a sign or symptom, think of the drug first versus anything else that's going on. Rule out that the medication isn't causing that first. Mm-hmm. And we don't do that often enough. And physicians don't do that often enough. So we really have to look at the medications, because medications, the side effects that are listed is one aspect, but there's something called adverse events. And that doesn't happen often for many people, but it can happen. And so it's really important to know that if you're having an issue, that you relate it to the medication and rule that out first.
Thanks for tuning in to Unshelling Medicine Podcast. If you want to stay up to date with the latest episodes, make sure to hit that subscribe button on your favorite podcast platform. If you enjoyed today's episode, please take a moment to leave us a review. Follow us on social media at Altruistic Scribe on Instagram, TikTok, Facebook, YouTube, and LinkedIn. We share additional tips, updates, and health-related content that you won't want to miss. Have any questions or topics you'd like us to cover in future episodes? Reach out to us at altruisticscribeco.com. We're always eager to hear from our listeners and tackle the health topics that matter most to you. Until next time, stay healthy and take care.